Hi everyone and welcome back to the channel. Today we're diving into a really important topic that affects millions of women, often without them even knowing it. We're talking about osteoporosis. You've probably heard the term, but what does it really mean? Osteoporosis is a condition where your bones become weak and brittle. Imagine the inside of your bones like a honeycomb. With osteoporosis, the spaces in that honeycomb get bigger, making the bone less dense, and more likely to break from a minor fall or even just a sneeze. It's often called a silent disease because you might not feel anything is wrong until a fracture happens. But are there early warning signs we can look out for? Absolutely. And some of them are surprisingly subtle and easy to dismiss. For example, have you ever noticed your gums receding? It might not just be a dental issue. Your jawbone supports your teeth, and if it starts to lose density, your gums can recede. Another sign is a weakening hand grip. If you find it harder to open jars or firmly grasp objects, it could be linked to lower overall bone mineral density. Then there's the classic sign many people joke about: getting shorter. Losing a little bit of height as you age is common, but losing an inch or more can be a red flag for compression fractures in your spine, a hallmark of osteoporosis. You might also experience back pain that seems to have no clear cause, or notice your posture becoming more stooped or curved. Even your fingernails can offer a clue. While brittle nails can be caused by many things, they can sometimes indicate that your bones are lacking strength too. It's so easy to attribute these things to just getting older, but they could be your body's way of telling you to pay closer attention to your bone health. So, if you've noticed any of these signs, what's the next step? Don't panic. The best thing to do is talk to your doctor. They can assess your risk factors and, if necessary, recommend a bone density scan. This test is quick and painless, and it's the gold standard for diagnosing osteoporosis. It's called a DXA scan, which stands for dual energy X-ray absorptiometry. It uses a very small dose of radiation to measure the mineral content of your bones, usually in your hip and spine. The results will tell you and your doctor exactly how strong your bones are and whether you have osteoporosis or its precursor, osteopenia, which is a state of lower than normal bone density. Getting this scan is a proactive step that gives you the knowledge you need to take control of your health. The good news is that an osteoporosis diagnosis is not a life sentence of fragility. There are incredibly effective treatments and management strategies that can help you maintain and even improve your bone density. It all starts with nutrition. Your doctor will likely recommend increasing your intake of two key nutrients: calcium and vitamin D. Calcium is the primary building block of your bones, and you can get it from dairy products, leafy greens like kale, and fortified foods. Vitamin D is just as crucial because it helps your body absorb that calcium. Sunlight is a great source, but supplements are often recommended, especially in less sunny climates. Beyond nutrition, exercise plays a starring role. Specifically, weight-bearing and muscle-strengthening exercises are your best friends. Weight-bearing exercises are any activity you do on your feet where your bones and muscles work against gravity. This includes things like walking, jogging, dancing, and climbing stairs. These activities stimulate the cells that build new bone. Muscle-strengthening exercises like lifting weights or using resistance bands also pull on your bones, which signals your body to make them stronger. It's never too late to start, and even gentle activities can make a huge difference. In some cases, your doctor might also prescribe medication to help slow bone loss or stimulate new bone growth. The key message is to be proactive, not reactive when it comes to your bones. Don't wait for a fracture to happen. Pay attention to those subtle early warning signs. Talk to your doctor about your risk. And don't be afraid to ask for a bone density scan if you have concerns. By making smart choices with your diet, staying active with the right kinds of exercise, and working with your healthcare provider, you can manage osteoporosis and live a strong, active, and fulfilling life. Your bones support you through everything. It's time to give them the support they need in return. Thanks so much for watching today. If you found this video helpful, please give it a thumbs up and consider subscribing for more health and wellness content. Stay healthy, and we'll see you in the next video.